pyramidal bony cavities situated on each side of root of the nose. They provide socket for rotatory movements of eyeball. They also protect the eyeballs. Major contents of the orbits are eyeball, fascia, muscles, vessels, nerves, lacrimal gland, and orbital fat. Shape of the orbit. Each orbit resembles a four-sided pyramid. It has an apex, a base, and four walls. The apex is situated posterior end of the orbit at the medial end of superior orbital fissure. The base, which is seen the orbital opening of the face. The four walls are roof, floor, lateral and medial walls. The axis of orbit. There are two types of axes are there. Optical axis and orbital axis. First we can discuss the orbital axis. The orbital axis is a line that passes through the apex of the bony orbit or the optical canal and the center of the opening of orbit. The visual axis represents the direction of gaze. The ray traveling from the fixation points towards the center of the entrance of pupil of eye represents the direction of the visual axis. The ray reaches the fovea from the center of the exit pupils. The angle between the optical axis and the visual axis is generally called as angle alpha. It is about 23 degrees. The roof of the orbital cavity, it is concave from side to side and it is formed by the two bones, the orbital plate of frontal bone in front and lesser wing of sphenoid behind. The anterolateral part of the roof present a fossa for the lodgement of orbital part of lacrimal gland. A trochlear notch or a spine at the anteromedial angle of the roof give attachment to the pulley for the superior oblique muscle of eyeball. The optical canal is situated at the extreme posterior part of the roof between two roots of lesser wing and body of sphenoid. The floor of the orbit, it slopes upwards and medially to joins the medial wall. It is formed by three bones. Orbital surface of body of maxilla, zygomatic bone anterolaterally and the orbital process of palatine bone that is present posteromedially. The floor presents the infraorbital groove and canal which transmits the nerve and vessels of same name from inferior orbital fissure to the infraorbital foramen. Just lateral to the opening of nasolacrimal canal, the anteromedial angle of the floor gives origin of inferior oblique muscle. The medial wall. It is the thinnest wall and extends from anterior lacrimal crest on the frontal process of maxilla to the optic foramen. The medial wall is formed by four bones. From before backwards, frontal process of maxilla, lacrimal, orbital plate of ethmoid and body of sphenoid. The lacrimal bone present a vertical ridge known as the posterior lacrimal crest. A lacrimal fossa intervenes between anterior and posterior lacrimal crest. It lodges a lacrimal sac, which is continuous below with the nasolacrimal duct. The anterior and posterior ethmoidal foramina lies at the junction between the medial wall and roof of orbit. They transmit vessels and nerves of the same name to the anterior cranial fossa. The lateral wall. It is the thickest and strongest wall and transmit force of mastication from the molar teeth upwards. The lateral wall is formed by two bones, zygomatic bone in front and orbital surface of greater wing of sphenoid behind. It presents small foramina for the passage of zygomaticofacial and zygomaticotemporal nerves. Just behind the lateral margin of orbit and slightly below the frontozygomatic suture, the zygomatic bone presents a palpable elevation, the Whitnell tubercles, which gives attachment to four structures: lateral palpebral ligament, cheek ligament of lateral rectus muscle, suspensory ligament of eyeball, and levator palpebrae superioris muscle. The foramina related to orbits are optic canal, superior orbital fissure, inferior orbital fissure, infraorbital foramen, zygomatic foramen, anterior ethmoidal foramen, and posterior ethmoidal foramen. The structures passing through the optic canal are ophthalmic artery and optic nerve. Structures passing through the superior orbital fissure are recurrent meningeal branch of lacrimal artery, lacrimal nerve, frontal nerve, trochlear nerve, superior ophthalmic vein. Inside the common tendinous ring, there are oculomotor nerve, abducens nerve, nasociliary nerve, and oculomotor nerve are present. In the inferior orbital fissure, there we can see inferior ophthalmic vein. Thank you.